First thing you'll want to do is remove any loose particles with water or a mouthwash like Crest Pro Health Rinse. Take a medium mouthful of the liquid, which is about 20 milliliters, and swish it around your mouth for about 30 seconds. When you're done, spit the rinse and any loosened particles out of your mouth. If you choose to use a mouthwash like Crest Pro Health Rinse, be sure to read the label carefully before use. This little brush is a must-have if you're wearing braces. It's called an interdental brush or an interproximal brush, meaning it fits between your teeth. At the end of the interproximal brush is a metal tip that can cause gum damage if not used correctly. Prior to using the brush, slightly bend the tip. Slip the interproximal brush in between the brackets and under your arch wire, away from the gums to gently remove food debris. The interproximal brush is a great way to check to make sure that all the food is gone, and it only takes about 30 seconds to do. Since some are pocket-sized, I suggest you keep one with you just in case you need it after meals and snacks. Many people feel much more confident with their oral health when they include a water flosser in their oral hygiene routines. Please note that a water flosser does not take the place of flossing, but it does a great job of helping to remove plaque and prevent gingivitis when used properly. You'll want to follow the recommended procedure provided by the manufacturer of your water flosser, but for this particular model, I fill the device with warm water. When you're ready, put the spout of the water flosser in your mouth. Angle the tip along your gum line, along the back of your teeth, and close your lips. If you don't, the water may spray. Choose a starting point in your mouth that is comfortable for you and turn on the water flosser. Move the angled head along your gum line to ensure you are spraying water in between your teeth and where your teeth meet your gums, both in front and behind your teeth. Ensure not to point down into the gums. It could cause gum damage. I recommend you focus on a quarter of your mouth at a time and spit out the water in between each quarter. This will most likely take you about 20 seconds for each quarter. It is very important to remove any food from in between your teeth, and traditional floss is a great way to do this. With braces, you will need to thread the string of floss under your wire and in between each bracket. It takes time at first, but you'll get faster the more you practice, and soon it'll take you about 2 minutes to do. You can use Oral-B Super Floss or a floss threader, as these products work well to help you get around your braces without shredding your floss. Gently pull the floss under the wire and move the floss forward and backward, and up and down and in between your teeth, and just below the gum line. Ensure to floss with a C shape to contour the tooth for optimal cleaning. If you notice your floss looks fuzzy, throw out that piece of floss and try a new piece. That fuzziness can get caught in your braces and cause the floss to shred. Repeat this process for all of your teeth and try to do it after every meal, or at least twice a day. If you are not a regular flosser, you may notice bleeding. This is expected, for healthy gums do not bleed. You will notice once you start flossing every day, the bleeding will stop. When you have braces, the area directly around your brackets creates some tiny, hard-to-reach spots that regular brushing can miss. This specifically designed electric toothbrush head, called a power tip, is made to remove plaque in these areas. Make sure the power tip is attached to your Oral-B electric toothbrush as described in your manufacturer's instructions. Then apply a pea-sized amount of toothpaste to the bristles. Angle the bristles of the power tip toward the gum line and in between each bracket. Ensure that the power tip doesn't actually go into the gums, for this may cause gum damage. This will help you remove any debris hidden around your brackets. Brushing your teeth with braces could possibly be the most important step in your oral health care routine. Most people are familiar with how to brush your teeth without braces, but when those braces are on, you want to make sure you're getting your teeth clean. This is an Oral-B Triumph Orthodontic Power Brush specifically designed to clean braces with its orthodontic tip. Add a pea-sized amount of paste to the bristles. Unlike non-powered toothbrushes, an electric toothbrush does the cleaning movement for you, so you just need to guide it along the right spots. Turn on the power brush and start with the biting surfaces of the teeth. This will soften the bristles. Use a back and forth motion for the upper and the lower. Now for the braces, hold the brush at a 90-degree angle to the tooth. half of the bristles above the brace and the other half below the brace. Move to the back of each tooth. Gently rock forward toward the front of the tooth. Make sure you focus along the gum line. Move to the next tooth surface and repeat. Finally, for the back of your teeth, keep the brush at the same angle and gently rock forward along to clean each surface. Try to avoid using excessive pressure. You can just trust the brush to do the work for you. Some of Oral-B's toothbrushes come equipped with a visual pressure sensor that will activate a red light identifying when you're using too much pressure. Brushing too hard or aggressively can cause irreversible gum damage. Brush a minimum of 3 times a day, after breakfast, lunch, and before bed. If you don't have an electric toothbrush, a manual toothbrush will work well. Ideally, brushing with braces should take 2 to 4 minutes if done accurately. Now that you're done cleaning all your teeth, you'll want to make sure that your breath is fresh and your teeth are toothpaste-free with a quick final rinse. You'll want to use either water or mouthwash like Crest Pro Health Rinse. Take a medium mouthful of the liquid, which is about 20 milliliters, and swish it around in your mouth for about 30 seconds. After, simply spit the rinse out into the sink and you're done brushing. If you have additional questions about how to brush with braces, be sure to ask your orthodontist or dentist. There are some other things you can do to help keep your teeth healthy during your orthodontic treatment, beyond brushing your braces properly. If you want added assurance to prevent white spots on your teeth when your braces come off, ask your dentist or orthodontist to apply Vanish XT from 3M SB. It delivers fluoride to the teeth throughout your treatment. Getting into the habit of brushing your teeth 3 times a day is beneficial. Many people find it easier to fit in a good oral hygiene routine in their day when they wake up, after lunch, and before bed. Practice really does make perfect. Good oral hygiene takes time, but you'll love the results because in the end, your teeth will look great. This will also build lifelong good habits. Visit your dentist for a cleaning 3 months after you get your braces on. At that time, ask your dental professional how many months in between visits would work best for you. This could be every 3, 4, or every 6 months. For best results, if you can coordinate your dental cleanings with your wire changes at the orthodontist, the hygienist will have ample access to your teeth and you'll have a more thorough cleaning. Carry proxy brushes with you on the road for those times when you know you won't be able to brush right after eating. They remove the debris quickly from behind your arch wire. That way you don't have to worry about food stuck in between the braces and you'll feel more comfortable. Brush your teeth with a wet toothbrush, no toothpaste needed, at home during activities that require sitting, like watching TV, reading a book. It's a great way to keep your gums healthy during treatment. Be sure to use minimal pressure to avoid gum recession. And let's not forget the tongue. Regardless of having braces or not, a thin layer of bacteria forms on the tongue. If you stick out your tongue at a mirror, you may notice a white film. This is the bacteria that causes bad breath. To clean the tongue, use your toothbrush or tongue cleaner. Use light, gentle strokes starting from the back of the tongue to the tip. Repeat until the white coating is gone. When brushing the tongue, breathe through the nose to prevent a gag reflex. And finally, avoid foods or beverages that are acidic or cause staining. These include juice, sports drinks, citrus fruits, or pop and soda. The most common foods for staining are coffee, tea, wine, and blueberries. If you are able to follow these tips, you should be well on your way to better oral health during your orthodontic treatment.